In regards to labor and delivery, you are going to be in contact with your primary midwife. So you're going to have her phone number and you're going to be in contact with her and you're going to make a plan. So sometimes that is a couple of conversations, letting her know things are progressing. Sometimes it's one phone call and it's time to get going. So because we're not here 24/7, we need a little bit of time to get here. So usually depending on your midwife, you're going to make that plan of when you're going to arrive. And when you get here, you get to check into your birth suite. You have the option to choose which of the 3 birth suites that you'd like. Although they are outfitted similarly, some people do have a preference, and you get to settle in and make that space your own. Throughout the labor process, we're going to be checking on you and your baby, which involves taking your vitals every 4 hours. We're going to be listening to baby at least every 30 minutes in the active stage of labor. And then as we get closer to pushing, we're going to listen a little more frequently because that's the baby's way of telling us if they're doing well or not. As far as who is in the building, typically it is your primary midwife, and then closer to pushing, she'll call in the assistant midwife. Depending on your level of preference, a student may be participating in your care, but of course you spent time with them and met them throughout your pregnancy. And then we are going to listen to you, help you choose where you want to deliver your baby, whether that's in the tub, on the bed, on the floor, standing up. Really, it's up to you. We're just there to guide you. We're not there to force you to be on your back or do anything unusual. When your baby comes out, they're going to come right to your chest. Anything that we need to do to your baby in regards to medical care, as far as listening to their heart and lungs, helping them transition, we can do with them on your abdomen. There's no reason for us to separate you and your baby. And that includes not cutting their cord. Optimal cord clamping is recommended 30 to 60 seconds in the medical care, but we really let that cord go as long as possible. Sometimes even after the placenta is delivered, we want your baby to get as much of their blood as possible. Like I said, your baby is going to stay skin to skin with you. There's no reason for them to go anywhere but on mama and daddy. And so we are just going to monitor them and you. We're going to monitor their breathing and their heart rate, their temperature. We're going to monitor your vitals, including your blood pressure and your blood loss, and just make sure that you and baby are doing well and staying stable. We need to have you at least a minimum of 2 hours of stability here at the birth center. That's required. But most of the time, the average family stays anywhere between 4 and 6 hours. And so what it looks like during that time is that we continue to check on you and baby. We give you bonding time. You're going to eat a meal. You're going to get up and go to the bathroom. You're going to feed your baby and really just snuggle in and just do a little bit of recovery while you're here at the birth center. And then at about the 2-hour mark, we do a little newborn exam on the baby. We're going to weigh them, measure them, check them out head to toe, administer any medications that you might desire for the baby, including vitamin K or erythromycin eye ointment if you desire those. And then after you and baby have been stable for at least 2 hours, but typically, like I said, a minimum of 4 to 6, then we're going to get you guys settled and get you home.